Welcome to the real side of postpartum. I'm literally balding. I'm currently 4 months postpartum and I am losing all of my hair. Like, no joke, I'm going bald. I was not prepared for this stage of postpartum. I'm gonna show you. So literally, all of this used to be all filled in. Like, look at how bad that is.
If this young woman's experience sounds like yours, I would not be surprised. Up to 50% of women experience some level of hair thinning or shedding or hair loss after pregnancy. And there are two big reasons for this. Number one, pregnancy is stressful on the body, and so that can impact your hair loss. Number two, when you're pregnant, you have very high levels of estrogen. And estrogen actually acts as a protective mechanism to prevent hair loss. But when you deliver a child, that estrogen does a nosedive, okay? So you have a major hormonal change that happens to your body. And when you decrease estrogen, you have less protective mechanisms to prevent hair loss. And that's why you're experiencing this hair shedding. It's also called telogen effluvium. Some people call it postpartum hair loss. But the big takeaway is this is a normal physiologic change that usually happens 2 to 4 months after delivering a child. Now, I do want to emphasize that if you're breastfeeding or you decide not to breastfeed, this has no impact on your hair loss whatsoever. The other thing that's important to know is that this condition can last anywhere from 6 months to a year, but your hair will resolve. And in fact, in all telogen effluvium cases that I've treated, all of them have resolved. Now, there's one other important thing to point out. If you do experience telogen effluvium, there's a possibility that there's an underlying medical issue. You can have a hypo or hyperthyroid, or you might be experiencing androgenetic alopecia, specifically female pattern baldness, which has a genetic component. And if that's the case, we can identify what the root cause is and we can treat it. But in most cases of postpartum hair loss, it has to do with the fact that you went through a stressful pregnancy, which is normal for anyone who's delivering, and two, a change in your hormonal levels, specifically estrogen. Now, I've treated a lot of women who have experienced this type of hair loss, and they all want quick treatments. And the reality is there's not always quick treatments because, number one, you are breastfeeding and you have to be conscious of what you still put in your body. And number two, hair loss takes a long time to resolve. But with that said, there are treatments that we can explore. So everyone talks about decreasing stress, but the reality is you just delivered a child. And once you have a child in the world, your stress levels, I would assume, would go up a little because you're going to have a lot of sleepless nights. So practically speaking, I don't know how you can decrease stress, but do your best to keep your stress levels as low as possible because that does have an impact on your hair. Now, there are medications that I would normally prescribe a woman who is postmenopausal or who is not currently breastfeeding or who didn't just deliver. But in your case, what I would start with are the non-invasive treatments. So first and foremost, you can try low-level laser therapy, LLT therapy. This is a red light cap. You can put it on your head. It's a little expensive. It can cost you anywhere from $1,500 to $3,000 for one of these caps. You have to be consistent. You wear a couple minutes every single day. There are a bunch of studies to support the efficacy of using red light therapy to stimulate hair growth. And this is a great option whether you're currently pregnant or you're breastfeeding and you're experiencing hair loss. This can help. Now, the next option is to take hair vitamins. Nutrafol is a great example. The problem with Nutrafol vitamins is that you have to take it 4 times a day. That's a lot. So the compliance in terms of taking these vitamins is very challenging. It is an option if you want to go down that route, but again, it's hard to maintain that routine of taking these vitamins every single day. With that said, if you take hair vitamins, these vitamins are beneficial, especially after you delivered a child. So you're going to have a double whammy. You're going to address your hair loss and you're going to be able to address the nutrients that you have depleted and you want to replenish into your body. So that is certainly an option to explore. There is one FDA-approved medication that is safe to use while you're breastfeeding, and that is topical minoxidil, specifically Rogaine. And I like to put female patients on 5% Rogaine foam. I think that is the best option because it's less irritating to the scalp. And you can use this 1 to 2 times a day, apply it to the area that is impacted by hair loss or hair thinning. Now, if you want an in-office procedure, PRP is certainly an option that helps stimulate new hair growth using your own platelets. But that is really the spectrum of what is safe within the realm of breastfeeding while experiencing this postpartum hair loss. If you finish breastfeeding and you're still experiencing postpartum hair loss, then there are oral options. I would consider putting you on oral minoxidil as well as oral spironolactone. These are medications that are safe after you're breastfeeding and you're not thinking about getting pregnant again. The other thing that's important is what you eat, your diet. So especially after delivering a child, you need to replenish your iron, your protein, your zinc, and your vitamin D. All of these will help contribute to new hair growth. I wish I could tell you there was a quick solution to resolve your hair loss that you're experiencing from postpartum hair loss. The reality is, unfortunately, hair loss takes a long time to resolve. Number one, if you do nothing and you don't use any of the treatment options I'm recommending, your hair will regrow on its own. This is a physiologic change that your body underwent, and it will do a 180. But with the treatment options that I did give you, I gave you options that are safe, especially while you're breastfeeding. If you have any questions that I've not addressed about postpartum hair loss, please leave them in the comments below. I'm here to help.